Up Close is presented by Tennova Healthcare, with 6 hospitals and more than 1,000 dedicated physicians. For more information, Tennova.com.
Thanks for joining us for Up Close. I'm Stephanie Aldrich. This week we take a look at the inner workings of our digestive system, something that seems mostly to be on autopilot and unnoticed. That is, until we start feeling that something just isn't quite right. Gastroenterologist Dr. Steedman Sarbah has helped treat digestive diseases in people all over the world. But he says what he's seeing more of here in the U.S. is a need to pay more attention to the liver and the risk factors that lead to liver diseases, especially fatty liver disease. And there are also some new recommendations he says are very important for overall liver health. We started our chat with the path that led him to Tennessee.
I'm originally grew up in England, as I say, bred and buttered in London. My family hails from Ghana, West Africa, and lived for a number of years in Southern Africa as well before heading to the US. I'd been in different parts of the US in Cleveland, and then moved down to get some Southern hospitality, and have been in Columbia, South Carolina, and now in Knoxville.
Well, it's probably given you some unique perspective, not just on the different types of health issues that people face in different parts of the world, because it all varies so much, but also just the way healthcare is approached as well. What are your thoughts about?
It's been interesting, even reflecting with the changes that we've been going through in the last year or so in the U.S. with the Affordable Care Act and the debate pro and against issues with regards to coverage. And it's been good to see some of the good sides of having a safety net to allow all patients to get some coverage, plus some of the issues that may be associated with it, and also see some of the different disease patterns. I mean, in other parts of the world where there are more infectious diseases and maybe coronary artery disease isn't the top of the list, and comparing and contrasting with the disease states we see in the Western world.
What led you into wanting to focus and have a specialty on digestive issues specifically? How did your path go into that?
In medical school, I'd enjoyed both working with my hands, and so was conflicted with whether I wanted to be a surgeon or the mental challenges of diagnosing and managing medical conditions.
And trying to figure it out.
Exactly. So this was a nice intersection between the two. That it's a procedural field where you can do things that you need the manual dexterity, yet you still have the intellectual side of medicine, especially with hepatology and liver diseases, to figure out and manage conditions that patients are facing.
You've seen a rise, and you mentioned it, in a need in a particular area, and that's not always talked about and is a little bit lesser known. Can you tell me more about what you're seeing?
Okay. With regards to liver disease, one of the things that we've been seeing very stark rise in is fatty liver. And for a number of years, people had assumed that, oh, this is just an innocent thing. You occasionally, where people were having ultrasounds for other reasons, you'd find that there was some fat showing in that, and up to 30% of this country may in fact have fat on ultrasound when they get imaging done.
But when I'm just sitting here thinking as, a potential patient, it's not something that's automatically on my radar. Gee, I think I ought to go get my liver checked along with my blood pressure and everything else. So what would initially, I guess, maybe be some warnings or some thoughts that, hey, maybe I should do this? Is it just in and of itself being heavier than you should, that you should automatically get that checked?
There are definitely certain groups that are more at risk of fatty liver disease. We see it in people that have cholesterol problems. So it's something that should be checked in that group, and also patients that have type 2 diabetes. They are more likely to not only have fatty liver, but more likely have more aggressive disorders where the fat can cause injury and have progression of damage to the liver.
And do I understand correctly that 30% of your practice thereabouts is now dedicated to liver issues now?
Both related to inflammatory conditions such as autoimmune liver disease, disorders like fatty liver disease, and then infectious conditions as well, such as viral hepatitis.
And is it mainly lifestyle choices that are contributing to this?
Not only lifestyle choices. Some of the other liver disorders include viral hepatitis, where people may have been infected years ago and not been aware of it.
Sure.
And also autoimmune liver disorders as well, where people have a genetic predisposition to have that.
Definitely something to keep an eye on. Can someone be of, I know like cholesterol can be deceiving too. Someone can look to be fit and of a
Absolutely.
so-called healthy weight and still battle high cholesterol. Can someone who has those characteristics of appearing to be fit also have fatty liver disease?
Absolutely. It was interesting, a few years ago I'd attended one of the Asia Pacific liver meetings, and we always think of some of the people from the Philippines as very thin and healthy.
And eating the better diet.
Eating the better diet.
Right.
And one of the presentations that was given by one of their hepatologists there about how they're finding their rates of fatty liver disease also increasing, and in people that are not necessarily the typical heavier diabetic that you'd maybe think that may be more at risk, but people that are thinner and have a lower body mass index.
Another disease that you look at and spend some time with is hepatitis C, and there was actually a recent CDC recommendation that came out about that. Tell us more about some of those changes in that recommendation.
The CDC had recognized that there are actually about between 3.5 and 4 million people in this country that have hepatitis C infection. Again, it's important because about 20 to 25% of these patients who have the infection and have chronic disease will go on to develop advanced scarring and cirrhosis and the complications of it. And it's something that, again, we have good treatments for if we find people.
But again, asymptomatic
Asymptomatic,
sometimes.
so often people don't know that they have it. And the CDC, recognizing this, found that about 75% of patients who have this infection are baby boomers. So recommended that anyone born between 1945 and 1965 should go ahead and request to get tested. Very exciting that actually just recently we had two very potent new drugs approved by the FDA.
And the baby boomer population needing to, for sure, get tested and screened for this, largely because there were just things we didn't know then that we know now, and tattoos were something that could contribute to those things, among other behaviors.
Yes, so hepatitis C is mainly a blood-borne infection. So the biggest risk in this country has been through IV drug use, and things happened at times with people in their youth, in the swinging 60s and 70s that put people at risk, and also tattoos. Sometimes people that had devices before the HIV outbreaks in the 80s, things we knew about sterilization weren't quite as well used, and in fact one of the biggest populations of hepatitis C in the world is in a part of Alexandria in Egypt, where 20% of the population was infected with hepatitis C through a program to eradicate an infection called schistosomiasis, and where they were going out and injecting medication for people and re-sterilizing the needles in tepid water. So in that population, it has the highest prevalence rates in the world. So what we know now helps people from getting new infections, and we know as well that it's only recently we were able to identify it. So it was first isolated, the structure of it in 1989, and before that the blood banks weren't able to test. So there were 300,000 patients in this country that got tainted blood that subsequently got hepatitis C.
Hard to imagine not having symptoms with this for something that can cause so much potential damage. Any kind of signs at all that people should think about or take note of?
Oftentimes people may have fatigue, but everyone these days is running around, and
there's a lot of reasons
all tired,
to be fatigued, right?
So the symptoms that typically people would get early on are really nothing that would stand out,
right?
Which is why anyone that's been at risk should be tested.
I want to talk about something else that can really disrupt someone's daily life, because it just comes down to what do they eat, and we're talking about people who can't tolerate gluten or celiac disease. But is there a range within that, right? Are there some sensitivities versus full-blown celiac disease?
Yeah, so one thing we're recognizing is that what we classically had thought of as celiac disease was probably just the tip of the iceberg. So oftentimes people with that will present with malabsorption and may have diarrheal disorders. But we now know that a lot of people may be diagnosed later in life with nondescript abdominal pain, that sometimes they've been told they have irritable bowel, or sometimes people with anemia, iron deficiency anemia, sometimes can be caused by celiac. So we recognize now that there a whole category of different presentations of this disorder, and we're seeing it more frequently than we used to see in years gone by.
And that's what I was going to ask you. Is it happening more often, or are we just diagnosing it better?
It's actually probably both of those.
Okay.
There was actually a very interesting study that was conducted that looked back at blood that had been collected and stored from Warren Air Force Base back in the 50s. It was actually collected between 48 and 54 on about 9,000 young, healthy volunteers. Now, with soldiers that were there, they had blood drawn and stored. And they went back and actually looked at those samples, and one of the ways we diagnose celiac is through some antibody testing. And so they checked for the antibodies in these stored blood and found that about 0.2% of that population had antibodies which may suggest celiac. They then went and compared with two cohorts now. One group that was, again, in the same young age group, so 18 to 25-year-olds, about 5,000 in that group, and then another group that age-wise would be about the same age as the original group, and found that about 0.9%, so almost a five-fold increase in the antibodies that you find. So definitely it's more common now than it used to be, but it's also been postulated that the part of it is that it may be some of the changes that we have in our environment. So the immune system usually is primed to look for things that may be invading or attacking. And there's a hygiene hypothesis that these days we're so healthy with our Purell everywhere we go, and Lysol wipes, that sometimes in that hyper-sanitized environment, the immune system may go awry, and it's found that not just with celiac, but other autoimmune disorders and other conditions, we're seeing them more frequently in the population now. So definitely it's more frequent, but we also are used to looking for it more these days.
Because it would be, like you said, it was maybe initially just thought to be irritable bowel.
Exactly.
And then it would have to zero in on those, okay, well, what foods are actually doing this to me? And then you have to narrow it down more that way, I would imagine.
Yes.
Never an easy thing to deal with, but certainly maybe a little bit easier today than even 10 years ago, right? As far as having alternative food options, even in a regular grocery store, right?
Yeah, I mean, 5 years ago, to try and have someone go on a gluten-free diet, it was a terrible sentence to give someone, but
Sure.
but almost now any Kroger's or Publix or wherever you go, you see an aisle with all sorts of products.
Which is also indicative of just how many people are dealing with this, right? There is a market for it.
Yeah, it's become even for, as you mentioned, some people that don't actually have celiac may be gluten sensitive, and the one that is famous is Novak Djokovic, who's for tennis fans went on a gluten-free diet, but, not that he has celiac, but found that he was having some issues with his diet, and with this he found more energy, stamina, and was able to move his exercise program to another level.
Because it's not, having the gluten sensitivities or celiac, it's not just about being uncomfortable and having digestive problems with it. I mean, you can actually become malnourished with this, correct? Can you explain that?
Well, what happens with celiac disease is your body develops antibodies which start to attack the lining of your small bowel where your body normally absorbs food substances. And so those surfaces get blunted and are no longer able to absorb the nutrients. And not only does it cause malabsorption, but also patients with this disorder may be at risk of certain malignancies developing, particularly lymphomas that can develop in the small bowel as a result of the condition.
You talked about some of the environmental factors of, maybe being too clean or, the Purell and those kind of things. Are there any other contributing factors that you've read about that are speculations with why we're seeing this more often? I mean, is it even other foods we might be eating? Have you seen any research on that?
There are different theories, some related to, again, the processed diets and the changes in the Western world that we've had these days. Everything is super refined and processed, and then we'll add back in what should have been there in the first place.
Easy, quick,
yeah,
convenient.
Exactly, microwavable. So it may be related some with dietary changes and the community and us moving to having less raw state foods that right. aren't as we would normally find them.
Back to the other one though, about just more when someone is diagnosed with irritable bowel, any variety of things could send a person into that kind of state, yes. Right? Can you tell me more about what would be a diagnosis for that?
And oftentimes irritable bowel usually is after other conditions have been excluded, but people that have this condition often are more sensitive to pressure sensations. So we all have things that go on in our bodies all the time. The heart beats all the time and we're not really aware of it. Likewise, the bowel is always contracting, but we're not really aware of the contractions that are going on. Often with people with irritable bowel, they may become more hypersensitive to certain contractions and it feels like spasms that are occurring that then get painful symptoms with that. And with irritable bowel, some patients may have changes in bowel habit. A third of patients may present more with diarrheal symptoms, a third constipation, and a third get an alternating, which can be much more difficult to control, where one day they can be having diarrhea and the next day they can be bound up. You know? So often with that, they're more sensitive to pressure sensations, which we can treat with certain medications, and may have more problems with certain things that are in the diet as well that may be hidden even in gums or candies and things that you wouldn't even think about that can stimulate the bowel and cause their symptoms to flare up.
What are your thoughts about the use of probiotics? It's kind of been in the news a lot the last couple of years, even in yogurt commercials and on the vitamin shelves it seems to be a little more prominent. What are your thoughts about incorporating a probiotic into your daily diet?
I think it's generally a good thing. It's something that's easy to do. There are studies that have actually shown where probiotics can be beneficial, even in conditions like inflammatory bowel disease. In ulcerative colitis, which is one form of inflammatory bowel disease, there are preparations that show some benefits. There's something called VSL3 that's a probiotic preparation that is used in that condition. We know that there have been problems with a rise of something called C. diff or Clostridium difficile, where people that have had antibiotic exposure because of infections such as urinary tract or other infections then knock out their normal population of flora within their colon, and as a result of that, this organism C. difficile can proliferate and cause problems that can be very serious. And actually, one of the ways that people can actually help with reestablishing normal flora is with the use of some probiotics.
I want to talk about some of the more serious things that you deal with also with pancreatic and colon cancer. Two different things, and you still at any rate want to catch these things very early, but at the same time very hard sometimes to catch things early when they're not making themselves known.
With pancreatic cancer, it's still been a very tough nut for us to crack because a lot of patients that have this often will present late. They may not get symptoms until They get obstruction of the ducts that drain the liver, because the ducts draining the liver and the ducts draining the pancreas enter the intestinal tract through the same little hole, what we call the ampulla. So as the pancreatic cancer grows, sometimes that can cause obstruction and people get yellow or jaundice, but it may be a late sign, and there may already have been spread of that cancer to lymph nodes and other areas of the body. So it's been tough to treat. But the story with colon cancer is very different. The reason being that although, again, people may not have symptoms, there is an early precursor of most colon cancers, which is a growth called a polyp that is almost like a wart that can develop inside the colon. And we know that since the early 80s, where we've been having programs where we've been screening people over the age of 50 to make sure that they don't have these precursor lesions, and removing them with colonoscopy, we're able to then prevent colon cancer. And it's an important cancer. It's the second leading cause of cancer death in this country. Still, too many people die from this. There are about 150,000 new cases a year in this country, and about 50,000 deaths per year.
But we hear more about it, I think.
Yes.
And is that really the key there? We hear more about the need to get screened for it,
Yes.
especially if there's family history.
But I think there's still some work that we need to do. If we compare with other screening, like mammography screening and Pap screening, we know that the rates of colorectal screening are still lag behind. So whereas with Pap, 80% of the population may get appropriate screening, and likewise with mammography. With colon cancer, it's still in about the 50% range. So a lot of people either don't feel it's important or are afraid for various reasons. There are different reasons that people don't seek that healthcare, and especially the issue of, if I feel good, why do something is something that is still very, very common in the population. But it is very important, because not only can it save your life, it's a very quick, easy procedure. The worst thing of it is actually the prep to get ready for it the day before. But even if a cancer is found, when it's found in an early stage, both the survival is better and the therapies that are needed are a lot more tolerable. So sometimes when we remove polyps, we even remove very early cancers that have already started there, but the polypectomy cures it, and so you don't need any further surgery. If it's a larger cancer that has started to invade, you may need surgery, but if it hasn't spread to the lymph nodes and other areas, you may not need chemotherapy. So for each stage that this cancer progresses, you need a more aggressive therapy to treat it. But
even some of the early ones might be a treatment in of itself.
Exactly.
I want to talk a little bit about your time in Zimbabwe as well, because we talked about earlier about how you've kind of been all over the world, but some of your perspective with dealing with digestive diseases there, which are very different issues. You're talking about more like social and economic problems that contribute to that, correct?
We tended to see a lot more infectious diseases, so a lot of parasitic diseases. We would see things like TB, intestinal parasites, some of them causing diarrheas and other problems for patients. Interestingly, even there have been changes in patterns, with TV being what it is, and everyone seeing everything that happens in the US and in Europe, and wanting to emulate what happens there. Also, the diets have changed, and so
so what can we learn from them and looking in and having this perspective?
It's actually amazing that, for instance, with diverticular disease, we know that it's something that is more because of not having adequate fiber in the diet, and that used to be something that was not seen as often in those parts of the world. But now that everyone there is having this super refined diet with cornmeal that's processed instead of milled themselves, people
store-bought now
store-bought instead of milled at home. They're starting to see disease patterns that were more common in the Western world. So it's interesting, the transition that's starting to happen there.
And we can learn from that, correct?
Yeah, absolutely. I think getting back to some of the old ways may be a good thing.
What is just a main message that you want people to know, or something that you feel like maybe is commonly misunderstood?
You know, I guess one message would be that if you're having symptoms or problems that have been ongoing, don't be afraid to have it checked. Because, you know, we may have treatment that will easily take care of that and may prevent a more serious and more life-challenging event.
All right. Well, Dr. Sarbah, thank you so much for spending some time with us and giving us your perspective, and welcome to Tennessee.
Thank you. My pleasure.
Again, the CDC recommends that all people born between 1945 and 1965 get screened for hepatitis C, since this age group is 5 times more likely to be infected with the virus. So often there are no symptoms, it can go undetected and cause liver inflammation and lead to lowered liver function or even liver failure. The encouraging news is that there are new medications to treat it. We hope you'll join us next week for another edition of Up Close. I'm Stephanie Aldrich.
Up Close is presented by Tennova Healthcare, with 6 hospitals and more than 1,000 dedicated physicians. For more information, Tennova.com.